Hi everyone, welcome back to CareerBiome, and I'm here with Daniesha Govender. You'll tell us if I'm pronouncing that name very well, who is a researcher, and she'll tell us more about the university she's working at. But she has amazing research that she's presenting at the DSI, and she's going to bring us along, tell us what she's doing, and we are happy to hear from you, Daniesha.
Thanks so much, Maria. I'm very happy that you actually asked to speak to me.
Yeah.
So you said it perfectly fine. I'm Daniesha, and I'm a study coordinator for DDD Africa.
Okay.
And as you mentioned, we're based at the University of the Witwatersrand, which is in Johannesburg, South Africa.
Yeah.
So DDD Africa actually stands for Deciphering Developmental Disorders in Africa, and it's modeled after a very popular DDD UK study. So what we look at is developmental delay, and this is basically disorders that impact adaptive function, behavior, neurological disorders, can also cause congenital anomalies, and they manifest from like birth to early childhood, and they have serious impairment functions for the people who are diagnosed with this.
Okay.
So, there's about 9% of the global population that have developmental disorders, but particularly in Africa, they remain underdiagnosed, and we have something called the diagnostic odyssey. So that's when, a patient comes in, they have a child with certain impairments, and they can't seem to find a diagnosis for this child. And that's because in Africa, we have limited infrastructure, but more importantly, limited digital infrastructure.
Yes.
So when it comes to clinical care, there's still a reliance on paper-based methods.
Yeah.
And we now need to digitize.
Like get electronic records and
Yes, and that's something that's been mentioned a lot at the consortium, is trying to get onto digitizing all of our electronic health data.
Yeah.
So it not only makes it easier for data management, but it's easier to actually share our data. And more importantly, for African researchers to get funding, we have to have data management plan. So REDCap is set up in a way where it already has the framework for that. It can help you store large data.
Yeah, and I think it also helps you like standardizing, is it?
Yes, that's exactly. It's standardized format. So if we want to make our data talk to each other from multiple research facilities and expand our databases, we have to make sure that the codes and the terms we're using are matching what they're using there.
Yeah.
So it's not seen in this poster, but we actually also collaborate with our research collaborator in the DRC.
Okay.
So we also have some research participants that are recruited there.
Yeah.
And a big issue in a place like the Congo is that when they go to clinical sites, it's in rural environments, they don't have internet access.
Okay.
So REDCap Mobile is actually something that allows offline data capturing.
Yeah.
And then once they have internet, and
once it's stable,
yes, it then uploads it to the central repository. So that helps a lot as well.
With
Especially,
collection,
not everyone's walking around with big laptops, so it's
Yes.
something they can do on their phone, and they capture the data. So, it's helped a lot.
Yeah.
And through using this data management plan, from the 500 families we've recruited, we've helped to diagnose over 80, and we've already reported 40, and we're still hoping to diagnose more. Yeah.
Okay, so that is, I find it quite comprehensive, because there is so many, at the data science consortium now, there is so much talks about like data and also things like data quality.
Yes.
And so other than like the data collection with REDCap, are there like particular tools that you embed into, or is it just REDCap that is the central tool?
So we do use other tools, and that's for our bioinformatic data, and that's actually captured in another system called Decipher, which is basically like this universal database of children where they store variants. So it's sort of like every time you add to this variant database, if you have a patient with certain variants, you can upload it on Decipher, and then it automatically tells you in which other regions they have these same variants. So you can understand from a diagnosis, it's good to know where have we seen this before and what is the similar, phenotypic features. So
Amazing. And is this the research that you presented right here?
Yes, this is the research that I presented right here, and we actually have a manuscript in preparation to submit to Frontiers, which is basically a brief technical report summarizing the need for this, and also explaining how we can actually implement it in not just our settings, but other resource-constrained settings.
Yeah. Well done, Daniesha. I think this is amazing work. Do you do this as part of your, is it like part of a PhD, or is it just a research project?
So
is it like a master's?
I have to give a lot of credit to all of the other people involved in the project.
Okay.
So I've actually started over 2 years ago, although the project is actually about 10 or so years.
Okay.
They started in 2019 with recruitment, and it's 2 phases.
Yeah.
So phase 1, which was a 5-year project, was actually doing the recruitment, doing this clinical phenotyping and sequencing.
Yeah.
Whereas phase 2 is primarily based on the data that we then generate. So in phase 1, we basically have this rich African database of African dysmorphology as well as genomes.
Yeah.
And now we're just, the second phase of the funding is for analyzing it. And we're adding another component, which is methylation data.
Okay.
So for all of our unsolved cases that we couldn't find a diagnosis with whole exome sequencing, we're now looking at whether the methylation has the answer.
Yeah. I think this is amazing work, and the reason, again, we come back here on CareerBiome is to share some of this work that people are doing, to read some of the work if it's like published and others can access it.
Yes.
And so we can also speak about science in confines of the publications, like on the YouTube channel now. And I want to thank you, first of all, for your time, but also for that work and intention you put behind this. Well done, and shout out to everyone.
Yes, and just to add, we don't have an official website for DDD Africa, but from just a Google, you'll find all of our publications and see the wonderful research that we've done. Thank you so much for having me.
Of course. So thank you, Daniesha. It's been amazing speaking to you about your research, and I hope to keep in touch.
Thank you.